Hi guys, welcome to Plastic Surgery Education. Today we'll be talking about dimple creation surgeries. Now, dimple creation surgeries are gradually on the rise. A lot of young boys and girls are demanding dimple creations. So, let us talk about the common problems or the common queries which patients have regarding dimple creation surgeries. So first of all, can dimple be created surgically? Yes, of course, yes. Chin dimples and cheek dimples. Chin dimples and cheek dimples can be created surgically. They are created under local anesthesia. So how is it created? How is the surgery performed? So surgery is performed typically through the intraoral route, and what we try to do is we try to mimic or recreate a defect between the skin outside and the mucous membrane. So if we see the anatomy of natural dimples, the natural dimples are basically a dent or a gap between the zygomaticus muscles. So zygomaticus are some of the muscles in the face, and there is a gap between those two muscles, and when we smile, there is a typical sort of a puckering sort of thing. I have a natural dimple, so that is basically a congenital problem with the zygomaticus muscle. So we can do that surgically as well. Is it painful? It is done under local anesthesia. So you will feel one or two pricks initially in the cheek region, either intraorally or extraorally. And after that, it will be all numb. And the procedure takes place in around, I would say, half an hour to 45 minutes. The only main discomfort is when we go to a dentist and we have to keep our mouth open for the procedure to be completed. I think that is one of the only discomforts which we have after the local anesthesia is injected. Now, what if you want both side dimples to be done at the same time? It can be done at the same time. I personally don't recommend it at the same time because it is a bit difficult to match the exact positions of the dimples on both sides. But yes, it can be done on both sides at the same time. Where is the dimple created? Now, the general guidelines which we as plastic surgeons recommend to the patient is that we draw a vertical line from this lateral canthus. From this area, a line is drawn, and then a horizontal line is drawn from the commissure of the mouth. The intersection of these two lines is the area where most dimples are commonly found in the natural population or in the population who have natural dimples. Around this point, we recommend that the dimple be created, but obviously it is the choice of the patient as to where he or she wants the dimple. But generally, it is a bit superior, a bit inferior to this particular area where dimples are commonly created. What is the post-operative care? So since we have created the dimple through the intraoral route, some plastic surgeons prefer to do it through the transcutaneous route. So they go through the skin as well as through the mucosa. There are no suture lines, there are no cut marks over the skin, but that is one of the approaches. So whatever way the dimple is created, depending upon the comfort and convenience of your plastic surgeon, we have to take care intraorally. We have to be very meticulous about the oral hygiene. After we have food, after we have any tea, coffee, or any liquids, it is better that we rinse our mouth with mouthwash. We have plenty of water so that there are no food particles which are stuck in there in the suture line. So that is one of the important post-operative cares apart from whatever medications are prescribed by your plastic surgeon. Are the sutures removed? Sutures are intraorally placed if at all. So sutures are generally not required to be removed. There might be a bolster stitch which has been taken by a plastic surgeon. So that is again removed at around day 5, maybe day 6, depending upon the practice and comfort and what is the experience of your plastic surgeon. So suture removals are generally done at that particular time frame. What is the post-operative course after surgical creation of a dimple? So what happens is that we have a static dimple initially for the first couple of months, I would say. So by static dimple, I mean you would see a dimple even when you are not smiling. Now the natural dimples appear only when you smile, only when you animate. But a surgically created dimple for the initial couple of months is there even when you are not smiling. So you feel or you see a small dent over the area where the dimple has been created, and gradually as time progresses that static dimple goes on diminishing and it is replaced by a animated dimple. So I would say at the end of 3 months you would have a dimple which is seen on animation when you smile, and there would be just a hint of static dimple which would be seen even when you don't smile, even without animation. uh, what if I am not happy about the procedure? So dimple creation is a surgery which can be reversed. So if you are not satisfied with the dimple, if you are not happy, if you are not liking the dimple, then what can be done is we can go in and inject that place again. We can fill up that place. So what we have created is we have created a sort of this is the skin, this is the mucosa, and then we have sort of stuck them both together. Then again what we can do is this area can be filled together and we try to get it back to normal. So dimples can be reverted if you are not really happy with those dimples. Are there any complications? Yes, like any surgical procedure, dimple creation also has got its own set of complications. The commonest are hematoma, since it being over the face, it being an intraoral procedure, there might be a hematoma or a collection of blood which might need drainage at a later date in the post-operative course. Then infection is again very, I would say, probably the commonest complication in a dimple creation surgery. Why? Because it is in that area where hygiene maintenance is very important. So if as patients we are not compliant to hygiene maintenance, this is the area which is likely to infect very soon if food particles get stuck in there, if they are not cleaned on time. That is a very real possibility. So I think those were the common queries which patients with who intend to get a dimple created have. Again, at the cost of being repetitive, dimple creation is a surgery for which you should consult a plastic surgeon. Uh, Please don't go to any quacks. Consult a plastic surgeon. Get it done from a plastic surgeon if you are willing to, or if you want to get a dimple surgery done. Thank you guys. Take care.